I'm Lisa, and I'm the Western Regional Director of Sales for Safe Obstetrics Systems, the maker of the Fetal Pillow. The Fetal Pillow is an FDA-approved balloon device that's used to raise an impacted fetal head during a second stage C-section, making the delivery easier, safer, and less traumatic. We offer virtual training for any hospital that purchases fetal pillows from us, and also our distributors around the country. And I would actually like to go through with you what a virtual training will look like. First of all, when the hospital purchases the fetal pillows, either directly from Safe Obstetrics Systems or our distributors around the country, we suggest you go and have all of your team participate in our online training program. And then after that, we can set up a virtual training. I can tell you that we've all become very good at Zoom and Teams, and so we are ready to do a virtual training with you and your team. So, as soon as the fetal pillows are delivered to the hospital, and this is exactly what the fetal pillows look like, there are 6 of them in a case, we can set up time, and again, have your staff go through the online training first, and then after that, we can set up training for your providers and also for your nursing teams. This is what the fetal pillow looks like, okay? This is a sterile, latex-free device. It comes with the fetal pillow and a 60 ml syringe, because ultimately we're going to be using 180 mLs of sterile water, so it's actually going to be used 3 separate times to fill up the fetal pillow. So I will also let you know that we have some wonderful things that we can provide for the OR. This is a 5-step key guide that can be used in your OR, of course, to just remind everybody. And then also we actually have these lanyard cards to wear to also remind your staff of the very easy steps of doing the fetal pillow. So, what we want to do is, of course, we'll be doing sort of a Zoom presentation where I will actually be showing exactly how to use the fetal pillow, showing you all step by step as far as prepping the patient and having the physician insert the fetal pillow, okay, and then pushing, of course, the fetal pillow as posterior as possible. Of course, there's a lot more details and actually utilizing the fetal pillow that we can go through during the training. And then when the fetal pillow is in and the patient's legs are going to be going down after being in a frog-legged position, the fetal pillow is going to be filled up. And then I will tell you that once the fetal pillow is filled up, you are getting a 3 to 4 centimeter lift on the baby's head. We're literally going from a +1, +2 station to a -1, -2 station. And as soon as the fetal pillow is filled up and the physician is ready to start with the incision, again, the physician is going to be greeted with a much easier and a much safer presentation of the baby's head. So I will tell you that during the in-service, we can go through questions. Many questions that I received, such as, does the BMI of the patient matter? And I will tell you that during our FDA approval, a 33 BMI was used above and below, and it made no difference. Also, head presentation makes no difference. You can have an OT, an OA, or a P presentation, and it makes no difference. Some of the most important things to remember is to really take a proactive stance in using your fetal pillow, because once the physician has done the incision, you cannot use the fetal pillow. You need to proactively use the fetal pillow, which is really only used in about 3 to 4% of your total births. The minute you get into the OR, patient's getting ready, you put in your Foley catheter. If you do a vag prep, you do that, and then you put in your fetal pillow in preparation for a second stage fully dilated cesarean section. If you have any other questions, we are always available, or if you are interested in having fetal pillows in your labor and delivery, please check out our website at safeob.com, and we would be more than happy to get back to you as soon as possible.